We're very happy to see how effective these messenger RNA, these new types of vaccines, the Pfizer and the Moderna's, are against COVID-19.
The early data from an ongoing U of A-led study confirms the findings of the phase 3 clinical trials. These COVID-19 vaccines are 90% effective against infection under real-world conditions. Dr. Burgess and the U of A's College of Public Health has been following 3,000 healthcare workers and first responders in its AZ Heroes study. Once vaccinated, these essential workers take weekly COVID tests.
This is not only real world, it's almost like real world plus, because they're so much more in line to run into the virus than the average person.
I think you put it really well. This is real world plus because of the occupational hazards that our participants see on a day in and day out basis.
The AZ Hero study was funded by a $7.7 million CDC grant and also used data from similar studies in other parts of the country. The Moderna trial I took part in here in Tucson, as well as the Pfizer trial, found these vaccines to be around 95% effective against COVID. The AZ Hero study is much more comprehensive, though, including the study of asymptomatic people. The CDC has concluded, and this is important, based on the findings, vaccinated people likely don't pose a risk of spreading the virus to those around them.
So they not just protect the individual who's vaccinated, but they also prevent the spread of COVID-19 to other people. This study really supports the use of vaccine, not just to protect yourself, but to protect others as well.
The AZ Hero study will continue for another 12 months. Dr. Burgess says there are several more questions that still need to be answered.
If you get COVID-19, how long does your immunity last? We don't really know the answer to that question. Another important one is, so you were vaccinated, how long does the vaccine last? We also don't know the answer to that question as well. And it's through studies like this where we can look at symptomatic and asymptomatic infection that we can effectively answer those questions.